and welcome to today's segment of The Power of Money. I'm your host, Michelle Graves, affectionately known for the last 40 years, if you can believe that, as the Money Lady, both locally, regionally, nationally, and now internationally. And welcome to today's show. I'm excited about my guest for the next hour. I will be interviewing Dr. Anisha Singh, who is an internal medicine physician board certified on women's health, things that women need to know. Now, I'm going to say this right up front because we're not going to be able to cover all the questions that I have, not only as a female, but also as a woman who's vitally concerned about women's health. But she has agreed to come back on for a second segment to conclude this subject. She's also agreed to become an in-house resource for questions on medical concerns. Healthcare is a major, major issue today for all of us, but especially for us that are aging. And so she has so graciously agreed to do this. Let me give you a little bit of background on today's guest. She is board certified. She is Regional Chief Medical Officer for ChemMed. And that's a national organization that is involved in providing value-based medical care, and we'll talk about that. Her education includes the UPMC Mercy, University of Santa Monica Institute for Integrative Nutrition. And I quote her here, "I love my patients. Despite being in practice for over 20 years, I have not jaded and treat every patient interaction as a pure human-to-human, loving," and she is loving, by the way, interaction. She was first inspired to become a physician at age 9 after seeing burn victims in need of healing. Since gaining expertise in internal medicine, nutrition, and psychology, Dr. Singh has been dedicated to her patients' physical, mental, emotional, spiritual, and social well-being. "My favorite part is educating patients," she says. "I've seen how a little knowledge and simple changes can make a significant difference. I also enjoy being a loving presence in the lives of seniors." I bring you Dr. Singh as my special guest for the next hour, and we will be dealing with the subject of women's health, what women need to know. Good morning, Dr. Singh.
Good morning, Michelle. Thank you for having me in this show.
I'm glad that you were able to free up your time for this very important and vital interview this morning. I appreciate that so very, very much, Dr. Singh. So where do we want to begin? Let's talk about you, because I had you on before when you were dealing with breast cancer. What's the status on that?
Yes, so I finished my radiation treatment in end of November, beginning of December 2021, and since then now I'm cancer free. No more, 2022, 2023 is gone, so I'm very happy. Still taking care of my health. My hair is back.
Yes.
People said, it might come back either, color would be gone or would be curly, but I was hoping for curly, but it didn't come back curly, but it's still black. So overall, health is doing good. Energy is up, and I'm able to now again go back to doing my hour-long yoga, which I used to always do prior to the cancer, and then my 30 minutes to an hour walk, 30 minutes on a weekday, hour-long walk on a weekend. So I'm back to doing that because the bone pain with the chemo had kind of, was really intense. There was a phase where I couldn't walk for more than 10 minutes. So I'm glad to be back.
Well, I am certainly glad that you're back as well, and that you're back empowered to educate women on breast cancer, because as a doctor, you can talk about it, but until it happens to you, and dealing with the myriad challenges of cancer, number one, and then breast cancer, which is so vicious. Number two, do you feel that it has helped you to become even more empathetic with women that have experienced breast cancer?
Oh, sure. It has helped me become a better, for number one, a human being. And then I say that what I mean is a much more humble and a lot more empathy. I was a very healthy lifestyle kind of person prior to the cancer. I started doing yoga asanas, the yoga postures at the age of 30. I'm 52 now, so I got my cancer. I was 48. So I was doing really well with my eating. I was eating organic. I was exercising, doing my yoga, doing my walking, Pilates. And I did not have any family history of breast cancer. I had my kids before the age of 30. I breastfed my children. My BMI was really good. My weight was no more than 112, 113 pounds at that time. So I was really on a healthy side. I didn't eat much sugar. So I didn't have any inflammatory reasons, nothing to say, that I would be a candidate for breast cancer. So when I would have patients with multiple comorbidities, illnesses, cancer, I would, there is the medical science, they were either overweight, not exercising, smoking, eating unhealthy. But here I was, doing all the right things. So I never thought that I would get it. And when I got it, I realized that it doesn't spare. Today, with the way the environment is, the way we are using chemicals, whether it's in cleaning products, who knows, right? Even no matter how much organic I'm eating, when I'm eating out, not everything is available organic. Who knows what contributed to it? But I realized that it can happen to the best of us. It can happen to anyone. And initially, actually, I had shame around it. I was embarrassed, like me getting it. And then I realized, why not me? And what is in there? What is the learning behind it? And I learned that not only did was I not spared, but it allowed me to be present, to experience presence, experience what it means to be more than your body and more than your mind as you go through the journey. So I was working, as a physician. I was the center medical director at that time. And I never stopped working. It was in the middle of COVID, 2021. And my first oncologist told me that I should stop working. There's no way I can work through surgery and chemo and radiation. So I, of course, ended up changing the oncologist. And I said, well, I need to find somebody who will work with me because I'm ready to take care of myself. And I never, the whole journey was a spiritual journey for me. It was about how am I not caught in the victim mode? How can I go through this journey, observe all the changes? I got bald, I even lost my eyebrows, my eyelashes. I never wore a wig or anything. I was seeing patients. And so it is just the most spiritual journey that I have been, where I never wore this big, crown of being the victim of breast cancer, but rather a warrior. And also not trying to be, super macho about it, but just accepting and observing. And then when the patients are now there, I don't judge any patient for anything. That has been a huge change for me. I was anyway a loving provider, but now it's at another level, where I am anything that comes, who knows, where it comes from. And my job is to how to be available to my patients. And then also to realize that we don't have to become victim of our diseases or of our circumstances. So that was, a lot of learning.
It sounds like it was a marvelous, although painful, journey for you. Cancer is horrible. And there's so many types. I just lost my brother-in-law to pancreatic cancer after 2 years of experimental trials. And it was very, very awful. to watch his deterioration and how it affected his thinking and his response. But I want to flip because of you being a woman doctor, very actively engaged in women's health. And I want to spend some time with you, and I appreciate your openness and your transparency, because one of the things about doctors, and I will never malign the time and energy and commitment it requires to even go through schooling and residency and then assignments and then specialties. It's a lot of work. And then to be put into an environment where you are now at the very top of the food chain of people in terms of sickness. And we do know that sickness in the United States of America is just off the chart. It is. And women, because we are numerically the majority in this country, we have many, many challenges and concerns, many of which we don't even talk about, Dr. Singh, because it's like, I'm trying to make a living. I'm trying to take care of kids or grandkids. I'm trying to just eke out. And so women many times wind up at the bottom of the pile. So I wanted you to speak to that today as a part of what we're talking about relating to women's health. And because this program airs all over the world now, what you have to say is very, very important. So where would you like to begin?
You know, you said it right. We women have over time somewhere, become at the bottom of the chain, right? It's like the whole paradigm. There was a time, and there are still very few cultures which are very women centric. But right now, it's not about the woman becoming masculine. It's about the woman owning her feminine power. It's about balancing, creating that balance. And for the women to realize that it is in that living in that power that we can make numerous changes in the world. So for where I would like to really begin is for women to realize that we own it. We are the mothers. We bring life to the earth. We sustain life on this earth. And we need to take care of ourselves to be able to take care of the world. So, women on one hand have in some ways been reduced to just the body, right? It's like the attractive body on the billboards, the attractive body in the movies, the constant nips and tucks on the body. There is no end to how much it is taking for a woman to feel confidence in self, right? Doing so many bodily procedures. And then no matter how much you're doing, the mind is playing its own game, and the mind is going all over with all emotions. So for the woman to realize that somewhere in all this culture where this shift has become more body-centric, and then sometimes even mind-centric, we are way more. We are more than our body. We are more than our mind. When we talk about the body, mind, soul connection, and soul is a very, in some words, it's the woo word, it is the in word, but it's also the most confusing word. But it is that inner consciousness. You could use the word consciousness, you could call it your inner awareness, the observer within you that can observe your own mind. It's my mind, I am not the mind. It's my body, I am not the body. And that is the observer of the mind and the body. Once we sit in that power, once we nurture that, once we realize that power, that's when we can be truly available to our children, to our grandchildren, to our significant other, to our parents, to the society at large, to the country at large, to the world at large, to the environment, to the plants, to the animals. So women have this incredible power. We are the vessel, right? We are the vessel, the feminine energy, so while feminine and masculine energy is in both, it is sometimes the table is so tilted right now that we need to own our power again and go from there. And that's called the self-care. That's what we really need to do. Self-care is not about the facial and the pedicures and the manicures and the haircuts and the hair color. We need to take care. We are residing in this body. So, of course, we take care of the body. But then knowing that we're way more than our body. And then we're way more than our mind, even. And that was, something we all women need to realize. And that's when the real beauty, the real journey begins, once we start going deeper. So that's what that's where I would like to begin. It's
well,
like all the way deeper.
I think, if I might say so, what a wonderful beginning. A very internationally known pastor and spiritual leader, Michael Beckwith, announced 2 weeks ago, I believe, that we are now transiting quickly into the feminine. And he said because people are tired of the fractions and the warring and the bullying, all that testosterone does have an end, and said that we have to, in the emerging phoenix from the chaos of where we are today, and Dr. Singh, it is chaotic. I know you deal with it with patients, and it's like, what next? But despite all of that, out of the ruins will come something very, very powerful and very feminine. Women don't have to emulate and copy men. We stand on our own merits as amazing creatures that produce life every single day. So with that in mind, and I appreciate everything you've said, it's beautiful and powerful, and I know that my viewers are going to be listening attentively. But if we don't deal with the health thing, we don't want to transit into being sickly, downtrodden, cancer-ridden women. So where do we begin?
And you're absolutely right about that. So external to internal, that's true. So you can't even think about, deeper things if your body is not healthy. And so coming back to then keeping the body where it needs to be so we can function. Some of the things, you and me have talked about offline is some of the basic things that we want our viewers to, I want all my patients to know that are common. So while esoteric conversation and the energy, yes, we want to do that, and yet not in an unhealthy body. So for the healthy body, there is so many things that the women need, and so do men. And those are certain things that are common, right? And we can always delve deeper into it, whether it's nutrition, whether it's exercise, whether it's sleep. But let's go, to very specific and some of the common things that women are dealing with. I see right now geriatric population, but when I was doing my women's health fellowship, perimenopausal women. And then, of course, I have a daughter. So I'm a 21-year-old daughter. So I have seen the whole range and dealing the issues, whether it's from menstrual cramps to, urinary incontinence, to dealing with frequent urine infections in menopausal women, vaginal infections. There are even a good being able to have a great sex drive, or being able to fully enjoy a sexual activity. So, in all that sense, we can start anywhere that you would like to begin, inside out. Or even we could talk about natural ways that women can, help not have wrinkles. I have experimented with all kind of, I haven't done anything to my face. It's all through food. So I feel like there are all the things that I read when I was younger, I was always good about following through in my nutrition. So right now at 52, I don't even have eyeglasses, which is, most of the people find that amazing, but I don't need them despite chemo and radiation. So there are things that we can learn, simple things that young women can incorporate in their lives. So wherever, or we can talk about some things like taking care of your, pelvic health, anywhere you want to begin. So we make that part of the life comfortable. I want to even talk about stretchings and how that plays a role in making the body more healthy. So anywhere, Michelle, you want to take me, being I'm an internal medicine board certified physician. I did my training in women's health. I did my, through the University of Santa Monica, I did the spiritual psychology. And then I'm also a yoga teacher. And I've also done the Ayurvedic counseling. Ayurvedic medicine is from, 5,000 year plus old medicine from India. So combining all of that and my internal spiritual journey, anything, wherever you want to start with, I feel good about starting from the body, outside in, and taking us there.
I think this is so exciting. To my viewers in New York and soon to be Philly and Boston, and those are super aggressive women. More so as we move toward the Midwest and further, women pace themselves slightly different. But I'd like to start with the very broad subject of the female body as being different from the male body, and the fact that our needs and requirements are different. Can we start there with just a macro view of a woman? When you look at a woman, whether she's I would say, menstrual, female, all the way into an older woman, her body. Let's start with that.
Yeah, so clearly women's body is a lot different when we are talking about the women's body. Um, we have estrogen and progesterone. We don't have as much testosterone, so that makes our skin very different. So if you start with external, if you look at our skin versus a male skin, it is different. The texture is different. It is going to be more softer. We are, so then taking care of the skin is going to be super important. And we tend to show things then sometimes a little more sooner too. So I was just talking to my daughter this week. She just finished, graduated, and came back home after graduation. So she bought this can of Progresso. It was a chicken noodle soup, and I was like, "Oh, that's great!" Okay. So then I look behind it, and I'm like, sodium. I'm like, sodium was 1,600 milligrams in that can. And I was something like that, 1,400, 1,600. I can't remember exact number. But I actually took a picture of it. And I'm like, do you realize that after having this can at night, you're going to wake up in the morning with puffy face? Because that's one of the things she talks about. Mama, I have got a little puffy face. So so from women, where we have a lot, the soft tissue, the role the estrogen, progesterone is playing, the different layers are different. So sodium, I feel, is one of the things that, while for older women, I'm always teaching them, per serving, your sodium should not be more than 140 milligrams per serving. So if you're buying a can of soup, buying a frozen, goods, anything, even your cereals, don't think about just as salt. Think about sodium, because sodium is a preservative. So it can be present in more things. Salt is sodium chloride. So then the tongue tastes it as salt. But sodium is what you need to look for, anything that has got a label. So when you find sodium over 140 milligram, you got to be thinking twice, because then, especially if you're going to have it at nighttime, well, you're going to wake up with some puffiness, and you wonder what's going on. So from the women's perspective, I like to women, just from the health, even if you're eating out, and then you come back home and next day you're like, oh, I don't know why I wake up with this puffy eyes. And well, think about it. First of all, you're having probably alcohol. That does play a role also. But then the sodium. So I always caution men and women. But then you will notice that the swelling is sometimes so much more, I find, because women are so, conscious of their faces and don't want to have, and then you're trying to apply different things around your eyes to make it less puffy. Well, don't do that. But just watch your sodium at nighttime, and how much your alcohol intake. So skin is very different. One thing. Secondly, you do have breast, right? As we are going to get puberty, and older women are going to have breasts. So taking care of the breast health is super important. Making sure, today with the breast cancer being there in young women, breast exam, self breast exam is super important. So when you're showering, making sure you're doing a self breast exam, just palpating around, seeing if there's not anything new or something popping up. That's how I found my mass, unfortunately. I felt a lump, and that lump turned out to be a breast cancer. So always looking for a lump, making sure nothing is feeling odd. Anything that is super painful in the breast is not a problem. Anything that's painless, that's the problem. So whenever we are looking at breast, we are also palpating our underarms, because the lymphatic fluid is draining into the axilla, into your underarm, armpits. So that's why you always want to palpate there. So in case there is some cancer, I had like 4 positive lymph nodes. So in my left breast, I got cancer in my left breast with 4 positive lymph nodes in the left armpit. So always making sure you're palpating and just feeling. You may not feel any lymph nodes because when they're very small, you don't feel it. But just making sure once a month doing a self breast exam. And then again, taking care of the breast from the standpoint of not overly. I like to not use soap. So you will hear it from dermatologists. Soap is very acidic, and should be used in the underarm. For that underarm, making sure the sweat smell, but really not anywhere else. We are like any other animal. We can self-cleanse. When you shower, the water cleanses your body. So when women use too much soap around the breast, they will find drying of the nipples. That nipple areola area starts getting too dry. So it's best not to apply any soap around there. It's all nice and clean. You don't have to make it super acidic environment, and that causes more skin chafing and dryness. Generally, there should not be any soap applied on the arms, legs, anywhere except in the underarm. So for women, taking care of that, and if there is some nipple dryness, especially in the winter season, you're noticing, and despite not using soap, if you're using soap, stop the soap. But if you're not using the soap, then using something like coconut oil is, it's a great friend. Coconut oil, always having it home. I always have a bottle of organic coconut oil at home. Comes in handy for lots of skin issues. It helped me during my radiation because, after the radiation, I used coconut oil. I did not get any blisters or anything. I did not even get any hyperpigmentation. So that was really helpful. And the other thing I like to say for women, because, with the periods, you do get sometimes nostalgia, means breast pain, a little bit before the periods come on. And one of the good things you can do for that is aloe vera juice. Aloe vera is another name, and aloe vera in Ayurvedic medicine is actually called the girl's best friend. It's great for skin, right? Aloe vera gel on the skin, aloe vera gel on the hair is great. But then aloe vera juice, having even 2 to 3 ounce daily, and especially if you're going through that phase of breast pain, aches, pains during premenopause, or even menstrual cramps. It's great for during menstrual cramp, just having 2, 3 ounce. But I tell women have it every single day. You can have it on empty stomach, but even if you are forgetting in the mornings, then just have it any other time of the day. Aloe vera juice. So that's what, something different for women because it is really helpful for their overall health and for the breast pain. Even perimenopausal women will have breast pain. And so aloe vera juice is really good for it. And so that's great. And then for women bodies, if you have big breasts, making sure the skin under the breast stays dry. It's a common area for redness and fungal infections. So keeping that area dry is super important. Not using the soap in that area, but rather just pat dry it after shower. If need be, you can put baby powder, but not necessarily, as long as you're pat drying it, unless, it's too sweaty. That's one common area for women. And then, of course, going down, we have pelvic floor. Women pelvic floor is prone to getting lax twice. One, when we have babies, we carry this baby in us for so long, it stretches up pelvic floor. So the pelvic muscles tend to not be as, don't go back in place and become as tight after pregnancy. So, or even if you've not had a baby, when you go through menopause, you lose the estrogen and progesterone. And when you lose the estrogen and progesterone, your pelvic floor muscles tend to get a little not as toned anymore. So Kegel exercises, that's, all my patients, if it's a woman patient, I'm constantly talking about Kegels. Kegel exercise is a must for any woman who's given birth or going through menopause or postmenopausal. So if you're not doing Kegels, start it.
What is a
what is
Kegel?
Kegel?
Yeah.
Yes.
Yeah.
Yeah. What
I
is a
do
Kegel
them.
exercise?
I do
Yes. Do
them.
you
But
do Kegel?
yes.
That's good.
I
Yeah,
started doing
no.
Kegels like baby number 2 because things started looking a little different. Okay.
Yes. So Kegel exercise is so forgotten, by women. And then if you don't do it, when you, and that was a great time when you started, Michelle. That's what we want. We want women to start it right after they've given birth. And Kegel exercise is really pelvic floor muscle exercise. It's not abdominal muscle. So if person is, it's as if you were if you were peeing in midstream, if you had to stop your urination, or even I say sometimes women have difficulty with that. You don't want to try it, right? You don't want to try it when you're peeing and trying to stop it because that'll, that can give you urine infection. So not telling you to start it that way, but that's the idea. Or even anus, anal area, to tighten that area. But when you tighten that area, your legs should not be coming together. Your thighs shouldn't be coming together. Your belly should not be going in. You shouldn't be holding a breath or anything. I should be able to talk, breathe normal, and be doing Kegel. So like right now I'm doing Kegel and I'm able to keep up the same amount of conversation and not be able to, because I'm not holding any breath. That's actually a real Kegel. So if you put your hands on your belly, and then if you're doing Kegel and the belly goes in, you're not doing it right. It should not tighten the belly. Now, why Kegels? It's so important. So Kegel helps in multiple ways, and any woman who's interested in any kind of personal health should do Kegels. So it helps, number one, with preventing you from down the road having urge incontinence. Like, women, they're in the mall and they're like, gotta go, gotta go, gotta go. That urge incontinence, where you like want to pee, 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 like right now. You thought about it and now you want to pee. Well, that's urge incontinence. So a Kegel, and that, why is that happening? Because your pelvic floor muscle is not tight enough. So you don't have much, room between your the bladder is that cavity which has the urine sitting in it. And then, so that's in your lower belly. And then you have this little tiny urethra coming, right in front of vagina is that little urethra opening. And so the tube is like really short between this bladder and then coming out where urine is going to come out from, right? There's not much room there. Whereas in men, there's a whole penis, right? So the urethra transverses the penis. Well, here it's this tiny little thing. So if you don't have a good pelvic floor muscle, which is where bladder is sitting on the pelvic floor muscle, right? So so if it's not tight, then when you get the urge, the urine starts leaking, and the tube is just so narrow that you don't have much time, and you gotta run to the bathroom. Well, if you gotta run, then you run that time, but then you say to yourself, like, God, I better start my Kegels. So that's called urge incontinence, where you just have the urge and you've got to go. And then there is the other kind of incontinence where the bladder does get full a little bit, and the urge is with the mind. It's like your bladder is actually not truly full, but you thought about it, you got the urge, and now you got to run. So, and then the other kind where the bladder actually gets full. And now you're like, oh my God, it's not like full, but still it's full enough where you're like, oh my God, the tube should be tight. Above the bladder, the tube should be tight. But the tube is so like lax, and that's where the pelvic floor muscles will tighten up and make that, the sphincter tighten up. So there are medications, but medications have side effects. When you have Kegels, why do you need pills? Every pill has side effects. So do Kegels so then you don't have to take pills. And if I tell my menopausal women, if you end up, because in the short run, even if you need to take pill, start the Kegels. You can get off the pill. You don't want to take the pill. So then that's overflow incontinence, where now it's a little full, but still the muscles are not tight. When you're young, think of yourself, all the women on the call, think of yourself as when you were young. No matter how much the bladder was full, it wouldn't start leaking really. But here, why is it starting to leak? Because the pelvic floor muscle is not toned. It's just same thing as toning your biceps, You gotta tone those muscles. That's not a muscle that can be forgotten. You can do weights here and not do pelvic floor muscle exercise. So the pelvic floor muscle exercise is called Kegel exercise.
Mm-hmm. That's very interesting. That's very interesting that you're talking about Kegels, because men definitely don't have to do Kegels. I don't think. But on that same area of that, dealing with the complexities of just our birthing, the ovaries and the fallopian tube and how the baby grows, all of this is a monthly preparation for fertilization. Is that not correct? Every month, it's the whole ritual is about an egg being released, or maybe 2, or maybe 3, or more. Let's hope not. But nonetheless, if the timing is right, the sperm will fertilize that egg, sperm being from a male, and that egg will attach to the uterus. So and then from there, a baby grows and uses us as literally, it's a parasite. I hate to be weird, but you have a fetus that is living off of you as a woman. And so one of the things that I'm vitally concerned about is making sure that we birth healthy babies, since we've got all this mechanism down here. So can you first advise us as viewers what type of care we need to take in that area to ensure that we are healthy and vibrant beyond Kegels?
Yes.
Yeah, beyond Kegels.
Beyond Kegels.
Yes.
And yeah, we will one time, next time, if you want to talk about, we can talk about how many Kegels and how often.
Oh,
So we
I'd
can
like
talk.
that. I'd like that. Yep.
Oh,
I
yeah.
would.
Yeah, we can go into Kegels. And then yes, so taking care of your vaginal health, right? So and for women, this is where women need to understand we have a whole universe birthing inside from us, right? This is a whole human being. The universe prepares us, this is not a man-made thing where, how the uterus gets prepared. So we have to not be bought into this culture of like, gotta be so skinny. That's where women tend to become, a lot of them are not even having periods, because they go through this extreme amount of weight loss. The pelvic floor, by the way, needs some amount of good healthy fats also. So when the baby is, when we are taking care of this baby who's taking all nutrients from us, we need to support that by eating healthy fats, not just during pregnancy, but also women in general need the healthy fats. Postmenopausal women need it. And so do we need to make sure we are replenishing our iron stores with food. And we can go into that next time if we want to go there. But now talking about our vaginal health and making sure how are we, and Kegel, by the way, also helps in keeping our vaginal health strong. So women, as they, birth babies, the vagina loses the tone too. And intercourse can sometimes be also not as pleasurable. So keeping the Kegels, keeping your vagina keeps the area tight. So it is definitely a more pleasurable intercourse experience in older women if they continue to do Kegels. So that's that part. But then taking care of vaginal health. One of the common things for, in general, for women that they deal with from young age and then gets even worse when they're older is vaginal infections, itching, right? Itching, the two things. Urine infections start early. Sometimes women will start that in their teenage years, like I'm having a urine infection, as or itching in the vaginal area. Two things that are very common. And in older women, it gets even more common. I have some women that will come to me and they'll be like, why do I keep having this urine infection? So let's talk about that. The reason, one of the common, there can be many reasons. But for the first thing you need to figure out is, are the women using any soap? We talked about soap earlier. Soap is what? Acidic. What is the pH balance down there? Alkaline. What do we need to keep it down there? Very delicate pH balance in our vaginal area, in the urethra area. So, are the women using a soap down there? And it's interesting for me to find out how many women use soap. And then they'll say, no, I'm using a mild soap. I'm just using a Dove soap. No, no, no. Dove soap wasn't invented to be used in the vaginal area. So I would recommend, and this is the recommendation, no soap. No soap at all. Not even your glycerin soap, not even your
I
cow milk or goat milk
cannot.
soap.
I can't. No soap. Okay. Okay.
No soap?
No soap.
Again,
Okay.
you know,
Ah, 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 ah. Okay. Dr.
well,
Singh.
do you see, and how you probably have seen it on TV, right? The elephant goes in the pond, or the animals go in this river, and then they clean themselves.
Yes.
Nobody's using a soap. And mind you, none of them are suffering from vaginal itching or
I haven't
urine
looked.
infections.
I haven't looked lately. I really haven't looked at an elephant lately to determine if she has an itch down there. I,
They're not
but
needing antifungal creams and
I,
antifungal, insertions, no antibiotic you're giving them.
no
How are they
Massengale.
surviving these?
I mean, what about the internal cleansing gadgets? Nothing.
Oh, no douching. No,
Oh,
no, no.
okay.
I know. I will tell them no douching and no soap. Oh, it's like really. And I'll tell you the turnaround. People stop having infection. They're like, oh my God, all this time, the more infection they had, the more cleaning they would do.
Yeah.
They would, more towel wiping they're doing there and they're rubbing that area. Like, no, no, none of it. Just, you have holes in your body and they don't need cleaning. You don't need to put that, things in your ears. You don't need to, pick your nose. You don't need to clean your vagina and none of that. It is all natural.
Dr. Sang, this is very interesting. And
Try it.
and and and
So,
and you listen. I defer to your professionalism and your expertise because women do get, in my opinion, a lot of infections. And
yes.
I was told it comes from unprotected sex, multiple partners, general not good hygiene, um, transferable. And then our mothers and grandmothers told us, you keep it clean down there. You just better, because it's going to cause you problems. And so I think culturally and by tradition, doctors never told us that. You were the first doctor to tell me that. And I was like, has chemotherapy done too good of a job with you? Are you giving me advice? Are you
You
telling me?
know,
I mean, come on.
I'm telling
It's
you, even with
yours.
chemo, I did not have any infection
You did not.
because,
You did
no, no,
not.
no. I
Nothing.
had a urine infection. So, one of the common things with young women is, or, that when the young women start with urine infection, it's usually a sexual intercourse and then not urinating after that. So not to say that you got to urinate right after intercourse, but, after your after play, just make sure you are urinating and that way you're allowing for any because there is that pores going in the wrong direction, right? It's going inside direction. So with that sometimes there can be bacteria traveling inside your urethra. So it's not good, it is recommended to always pee, urinate after sexual intercourse. So young women, when they get it, that's usually when it starts. But then the women start having, little more because you are now puberty has hit, so you're going to have this mid-cycle increased mucosa in the, and your underwear is going to be a little stained, and now you're thinking, oh my God, now I better start using soap. You don't need to use soap. That's some mucosa, and having that the mucus, not mucosa, mucus on the underwear is natural. That's a vaginal discharge. If you are a healthy woman with a healthy amount of libido, where you feel excitement and you feel, if you have good sexual energy, you're going to have some mucus. You're going to have vaginal discharge mid-cycle, and you're going to continue that even post-menopausal. You may have it if your sexual health is good. You're going to have some vaginal discharge, and your underwear is going to be a little stained. But that's not a reason. And in fact, if you use the soap, you're just going to make matters worse, not better.
Wow, that information is worth a whole lot of money and a lot of doctor visits. And then so many times the recommendation is penicillin, which is an antibiotic, and we already know what that can do to the body. But it's refreshing to hear that. I wish your peers, many who are male, would, in fact, get current on that. Because, well, what about after menstrual? Now, I'm way over that. Hallelujah. But for our younger girls who are dealing with menstrual, how do you clean up after that?
Yes. And I will address the earlier question is you are absolutely right. Sometimes as we doctors are forgetting common things, right? I was in fact talking to a male physician just last month, and the patient had repeated urine infection and asked him, had he talked about vaginal health, not using soap? And he said, "Oh, I totally forgot about those things." So I did, we went over it. And same thing with wiping from front to back, So we went over that, but that is often overlooked. And we, as MDs and DOs, we are sometimes overlooking. So definitely there is more education in the women's health hygiene and needs to be talked about. Now with the menstrual health. Menstrual health also, after menstruation, again, periods is the blood. It can be very irritating for the women with periods, that can make the area a little bit drying because blood is drying. So keeping the area clean, but not using soap. Because the soap is definitely not, using water, taking showers every day and keeping the area just clean the area with don't dig into it. That's the other thing. What I find is if you are, because your vulva, right? Vulva is the two lips on the vagina. You're not supposed to kind of, because it can accumulate, you allow natural process. What happens is if you start digging into it to clean the area too much, it will actually irritate the area more. And now the harmful bacteria will get a chance to grow, the candida will the fungus will get a chance to grow. So actually don't dig into it, just gently clean the area, but again, just with water. I know in the beginning, during menstruation, the blood can be a little smelly. It's tempting, but believe me, if you clean it with water, shower is every day, cleaning that area is every day, but with water and gentle cleaning, no digging in there, not between the inner lips of the vagina.
Let me conclude our time, believe it or not, is up for this show. And we haven't gotten past this little bit dealing with the body externally. But I want to thank you, and I thank all of you in my audience. Circulate this video. It's going to be on YouTube as well as in other markets. But this is so powerful and so informational. I told her I want facts. I don't want old wives' tales. I don't want traditional garbage. I need women to be healthy, happy, and alive. And we have to have the good information. So I want to thank you, Dr. Singh, for today's segment on women's health, what women need to know. Takeaways: do your Kegels all the time. Stay away from soap other than in sweat areas like under your arms, etc., because soap is acidic and it can create problems. And stay tuned for Dr. Singh coming back again, because we're going to talk about this more. I appreciate you watching the show and listening in as you have over the years. And we're excited about 2024 as it relates to women's health. And you're going to get the help you need, and you're going to get the answers you want. I'm Michelle Graves, affectionately known as the Money Lady, for over 40 years now throughout the country. And we thank Dr. Anisha Singh, board certified internal medicine physician. Love you. Mwah. You take care.
Love you too. Thank you so
Okay.
much.
Bye bye.